sparsely populated places and visiting hospitals, both of which Mr Cummings did. Let's talk to Niall Dickson, who's Chief Executive of the NHS Confederation that represents health and care providers. Morning to you.
Good morning.
What are people telling you?
Well, to be clear, it's certainly not for us to comment on the merits or otherwise of this case, or really individual cases in general, but because of the way this story has unfolded, there's certainly concern among our members, health leaders, that it could damage staff and public confidence in official guidance. And you can't say too often that the guidance has actually saved thousands of lives. And I think if we look forward over the next few weeks, following that guidance is going to be as vital as ever. And actually it's going to be more complex because as lockdown eases, the advice is frankly less binary and people have to exercise more discretion. So I think there is concern that this has been a distraction and that it's not been helpful. And the fear is that it's made people on the front line frustrated and fearful.
That is a fear, and those are speculations. Does anyone, though, have any evidence? Is anyone hearing from members of the public, for instance, they're not going to follow the rules quite as intensely as they were?
No, not that I'm aware of. I think what we're reflecting is what our members are saying, which is that they are concerned that not so much that staff obviously won't follow the guidance, I think staff will, but that it could undermine more generally staff confidence in government pronouncements and so forth. And, you know, we've seen difficulties already with guidance, the supplies of protective equipment, the whole testing issue of supplies and distribution there. And that can lead to frustration, fear, and again, lack of confidence on the front line. So we have to, I think that both things are important. Of course, maintaining public confidence as far as we can. And to be fair to government, it is enormously difficult to maintain that confidence when there are so many voices and views. And of course, nowadays, social media is such a big part of where get their information.
One of the things I mentioned in the introduction, one of the things that we have been asked not to do, people have been asked not to do, is not to go to second homes and not to go generally to put strain on parts of the country where that are more sparsely populated, where there are fewer hospital beds. How much of a concern is that? Because that is something that Dominic Cummings did, no question about it. And if others do it, the impact would be what?
Well, I suppose the answer is that when people show the kind of scenes which are being shown in parts of England where there are very large numbers of people flocking to destinations which are not ready to receive them, then obviously I think that is a matter of concern. We'll have to watch, and to be fair again, the government has made it clear that if the R number goes up, then these are not definite things they're going to do, or indeed they could even reverse them if they think that there is any danger that the R number could go over 1 and we could see the virus pick up again. But obviously, what the advice that people are being given now is to exercise a degree of discretion. It's more complicated than simply saying stay at home. It's more complicated guidance, and as that happens, the appeal has to be to individuals to exercise their common sense, their discretion as they do going forward. And clearly this whole episode, I think, has made that message more difficult.
Niall Dickson, Chief Executive of the NHS Confederation. Thank you very much.